Welcome back, everyone. Most of us probably don't think about joint injuries until maybe it happens to us. Well, fortunately, there are fantastic doctors like my next guest right there to step in and fix the problem. Dr. Sergio Viroslav is a practicing orthopedic surgeon at Baptist Health System, and he is here to educate us. Thank you for being here.
Thanks for having me.
I've already learned so much from you. We were talking during the break, and I asked you if are joint problems normally associated with, you know, the older age, and you said not necessarily.
For sure, the biggest group of people are 65 and up.
Right.
But there are so many people that come in 30s, 40s, and 50s, and sometimes it's no fault of their own. They sometimes were born with problems. Other times it's from an injury. If you're in the military, jumping out of airplanes, as we were talking about.
Well, yeah, I hear that can do it. Okay, so what are some of the most common problems that people come and see you about when it comes to joints?
Well, most of the time people say, I have a problem in my hip or I have a problem in my knee, and I don't know when it started. And that usually prompts an evaluation, an exam, x-rays, etc. And that's where we get to the meat of the matter, so to speak.
Another thing that was interesting, we were talking about hip replacements and hip issues, and you said, again, a lot of younger people have hip issues. And again, I associate that with being older, falling and hurting your hip, but a lot of younger people have the problem.
There has been a renaissance in hip pain, a lot in women, where they end up getting pinching of their hip and it ends up causing early deterioration.
Okay.
We don't really know why. Sometimes it's related to just being born a certain way, and that can lead to earlier changes in their hip well before they're in their 60s.
That is no fun, especially if you like to get around and you're a really active person.
It's very common in active women like yourself, runners, folks that do yoga, working out. Nothing is protective 100%. Sometimes bad luck does happen.
And in the worst case, sometimes you have to do hip replacement.
Right, and that is the key statement. In the worst case scenario, we never start with that conversation. It's very rare that we come, oh yeah, first thing you need is a hip replacement.
Right.
It's mostly folks that have tried everything else, they've done all the right things, they've been the model patient, and next thing you know, their x-rays are terrible, their motion is terrible, they're uncomfortable all the time. Hip replacement's a great option.
Now, let's talk about the hip replacement. That sounds scary. I'm sorry, but it does, Doc. It sounds, ooh, you know, like that's a lot. Now, and you brought a little trusty
model
sample here.
Right.
It's something that has to do with the hip replacement. But what do we have here, and how does that work?
So a hip replacement that we're showing here is truly a hip replacement. So the ball that used to be here has now been replaced by the ceramic pink colored ball.
Is this a woman's hip replacement since it's pink?
It can be. And this articulates or goes and is placed into a cup that's put into the pelvis.
Wow.
And then the muscles are closed over it. And nowadays there's newer and newer techniques to minimize tissue damage so people can get back to their life quicker as opposed to spending months and months in rehab recovering. And that's some of the neat things that are going on.
And what are just a few things people can do to prevent this situation? Maybe if they, like you said, if they're very active, what can they do to prevent injury?
For sure, listening to your body. So if you're already active and you're injured, there is a point where no pain, no gain is a mistake. You really do need to stop, rest, and recover. For other folks, and most of us really run into this, is that we don't get enough exercise. And then we exercise too hard on the weekend and don't do consistent conditioning and training. So really pay attention to your body. Talk to your doctor if you're going to start an exercise program. Well,
Dr. Viroslav, you are just so fun to talk to. You made hip replacement very fun and interesting.
Thank you.
That is not easy to do, and I appreciate that. All right, if you would like more info on the Baptist Health System, you can go to bhsjoints.com. Their phone number 297-7005. Thank you so much. Nice to meet you.
Likewise.
Thanks
Thank
for
you
being
having
here.
Me.